Well, I pay tribute to him for the work that he's done. He's always been courteous to deal with, and he's always been good to deal with. But the fact remains, I met with the Ambulance Trust last October, a year ago, making very clear my concerns about response times in rural Norfolk. A year on, we haven't achieved the improvements that we were hoping for. So this is an enormous area that the Ambulance Trust is covering, the whole of the east of England. The last government decided to amalgamate ambulance trusts to create this mammoth area. We need strong leadership to make sure that the service delivers the care that people need.
Now, you're campaigning about the reorganisation of the ambulance service, but it's your department, the Department of Health, that's causing these £50 million worth of savings to have to be made over 5 years. How do you square that circle?
Well, the problem we have is that the government, first of all, has ring-fenced health spending, so there's been no cut in spending on the health service, in fact a marginal increase. But the problem is that every year, because we have an ageing population, costs keep going up. So that means reform is necessary to make the money go further.
And do the people that you're talking to, the paramedics and so on, do they understand that you have almost a foot in both camps?
Well, of course there are enormous challenges here. I'm doing this as the Member of Parliament for North Norfolk. I have a responsibility representing people in North Norfolk to ensure that the service is of high quality and gets the care to people when they need it. So that's my job as Member of Parliament. As a Minister in the Department of Health, it's a question of how we ensure that the NHS remains sustainable.
Stuart Jackson, isn't Norman Lamb there being hypocritical somewhat?
Well, I couldn't possibly comment on that particularly. I think he's well known as a very diligent, hard-working constituency MP, and he's fulfilling that particular function. But yes, you could say that he also has to robustly defend the government policy. But I think he touches on a very important point about the size of the region. He also probably would make reference to the fact that there's a mixture of rural and urban, and of course we're an extremely fast-growing population in the eastern region.
I'm glad you brought that up, because I wanted to put that to Tim Huggan. I know your area is a rural area. We've got vast tracts of rural areas in the east.
Yes,
can we expect the same service in those areas?
We should expect a good level of service that meets patients' needs. I was talking to ambulance drivers just a few weeks ago, and they were telling me that one moment they'd be in Newmarket, and then on the basis of expected demand they might be in Kings Lynn the next moment, or shunted off to Ipswich. Now, when they're being shunted all around the region, apart from ambulance drivers' tiredness, it leaves a lack of cover in rural areas. In my particular area, if they're up at Kings Lynn, it's no use to a patient who needs an ambulance down near Newmarket. It just doesn't help.
We heard one contributor, Stuart Jackson, in the film there saying it's 2012, beg your pardon, not 1912. Coalition funding is having an impact on the health service, and in particular, as we heard there, on ambulance service.
Well, I don't know the precise circumstances, but to wait 3 hours when someone's possibly in a life-threatening situation, I mean, I can't believe there wasn't someone that could have tried to get that person in a car and taken them to the local hospital.
Well, is that what you're saying, that people have to do? People
no,
have to resort to doing that? That's what you just
quite
said.
Often they're given specific instructions not to let.
I'm not saying that,
people, not to move people. And if you're saying that they should pick somebody up, that's
what I'm saying is that
ridiculous.
There should be a level of education amongst people that the ambulance service can't be everywhere across a massive regional area, and in fact, you know, people need to understand that there are walk-in centres, there are clinics, there are hospitals, emergency departments that they themselves can reach, and it's just a factor of a huge growth in population and as I say, the rural and
say
urban
that from as an urban MP,
okay.
Because what we're talking about is with bus service cuts, with out-of-hours GP cover being reduced, it means that they have less means of getting service.
We have to leave it there. Thank you.